Now, can you just join the dais? For want of time, we can have a discussion of about 5 to 6 minutes. Dr. Gupta, what is the current recommendation for LPA measurement? Is it for?
Basically, there have been a lot of guidelines are there again, whether we are talking of ACC or ESC guidelines. Certain guidelines talk of estimation of LPA in the patients with high risk ASCVD or in patients with calcific aortic stenosis. But the ESC and Canadian guidelines, they talk of LPA measurements, universal screening, that in every person, at least once LPA estimation should be done. And certain guidelines talk of the LPA levels of 50 milligram per deciliter is the risk factor. But for Indians, it may be 30 milligram or more, maybe the risk factor for ASCVD.
I think even the WHO recommends once a lifetime measurement of
I think two different guidelines are there. So either we do a universal screening or patient with higher risk.
Dr. Gupta, one comment. Very interesting talk. Thank you. One very practical point I would like to mention based on a very recent study, the MISA study in circulation just 2024. They studied patients with high LPA and followed it up with low dose aspirin only. And they found there was a 46% reduction in events. So aspirin can be used in patients who have high LPA before we use all these other drugs. I mean, they will come, of course, but just aspirin.
I think what they have talked about, even though I've mentioned that statins slightly increase the LPA levels, but still they talk of if there is a high LPA level, still we have got approved pharmacotherapy. The statins should be used in high doses to bring down the LDL. That's the recommendation.
I think there is one more study which says that if you reduce LDL-C levels significantly, that gives cross protection against high LPA.
Actually, if you remember, the LPA was detected in the Asian population. This was a study which was conducted in USA several years back. Amongst the Indians who had settled in USA, they found that the incidence of coronary artery disease was pretty high. In that group, they started sort of estimating their LP little a. And they found that it was extremely higher incidence amongst the Indians. And here also you will find it has got tremendous genetic predisposition. And a tremendous, not only genetic predisposition to high LPA, but a very high incidence of coronary artery disease. I have one family in which there are 3 brothers, and 2 of them had a angioplasty, one had a bypass surgery, a sister. All of them had a very high LPL levels, more than 120, 130 milligrams. It has got a tremendously high sort of a genetic predisposition, also high genetic predisposition to develop coronary artery disease.
I just want
I'll add on to what Dr. Palajani said. If you see the Orion 18 terrain, they had specifically taken Asian patients, and they had high levels of LDL as well as very high levels of LP little a. And therein they found that the LP little a were close to almost about 90 in these Asian patients. And this could be maybe a part of the genetic problems as far as the Asians are concerned, and related to multiple vascular problems in these patients. And they found that the LDL levels were reduced by the statin, but the LP little a were reduced by the inclisiran as compared to the only statin which was used.
What is the lowest level of LDL has been observed with PCSK9 inhibitors?
So with the very stringent recommendation which has come from the Association of Lipids of India is that now they recommend, as I said already, that patients who have got recurrent coronary artery problems, and if they have a strong family history, particularly in diabetics, it is mandatory that you bring down the LDL level to less than 30.
I have one patient who's from Delhi. His LDL level after taking PCSK9 inhibitor for 3 months has come down to 6 milligrams. So I talked to the company people that is it safe? They said that in some studies from there, they found some of them at 0 LDL level. And they have lived like anybody else. So there are no side effects. It can be tolerated to as low as less than 10 milligrams also.
Sir, I
So
have
I'll just
three
add
patients with less than 10 milli and two with 6 and doing very well for more than 1 year.
So regarding the data also, the Fourier study which shows in the Fourier Ole trial which I mentioned, at least there were 300 odd patients who were less than 10 milligram. That is single digit LDL levels have been obtained. And that's why the safety data of that Ole trial stands a document for that it is safe enough in spite of reaching so low LDL levels.
So lower is better. Yes, Hiten.
Yeah, my question is about the primary prevention, the role of inclisiran, like that recently that UG Brownwell said, if you want to live 100 years, like a flu shot after 30 years, if you can take this inclisiran, you will live without evidence of CAD. But still, surprisingly, I think we are waiting for mortality benefit data are lacking. So, shall we wait till that time? Yeah.
Yeah, in fact, in inclisiran, as I said, the 2 ongoing trials are there, which are going to talk about the outcome of the patients who have got established atherosclerotic cardiovascular disease. And this is going to be related to the mortality benefits with inclisiran. Now, this data, which, this talk which Eugene Brownwell spoke about, is in fact ongoing now as far as UK is concerned through NHS. They have started giving inclisiran to people, to kids, and to 10 years onwards they have started giving, and to 20 years above the things. So we are waiting.
Dr. Kumbat.
So we are completely out of time.
Dr. Desai, what is the indication of inclisiran despite all other therapy? And what is the mortality benefit of inclisiran? And what is the cost?
The cost is significant. I think that we can talk to the Novartis people. But the thing is that we are talking about inclisiran. Now, the data which has been presented as far as the inclisiran is concerned were with high doses of statins. Now, the beneficial effect of inclisiran was beyond the levels at which the LDL was reached with these high-level statins, and to further reduce, inclisiran was reduced. But the effective, or as far as I am concerned, the benefit of inclisiran or PCSK9 inhibitors is going to be in patients who are not tolerant to high doses of statin. In those situations, it is going to be very, very beneficial.
We have to wind up, sir. Yeah. So by the time the photo is taken, I thank all the chairpersons and speakers for a wonderful session of these exciting new molecules.